Hello, my name is Rebecca Preddy, and I'm the Senior Federal Policy and Programs Analyst for the American Music Therapy Association, and I also serve as the Treasurer for the Health Professions Network. I'd like to welcome you to the 2020 Spring Health Professions Network Conference, where our subject is data and how it impacts healthcare delivery. Just a little bit about the Health Professions Network. The Health Professions Network is a collaborative group representing the leading allied health professions. Organizational members can include associations, educators, and accreditors. We're all working together to focus on issues relevant to healthcare workforce development and delivery in the United States. Our first speaker today is Chris Chmura, PhD, the CEO and Chief Economist of Chmura Economics and Analytics. Our presentation today is titled Using Data to Track Workforce Trends and Understand Need Across Different Occupations and Geographies. A thought leader on labor marketing data, Chris is a nationally recognized speaker among site selectors, economic developers, private firms, workforce practitioners, and educators. She has served as a keynote speaker for national and international conferences and is a quoted source on regional and national economic trends in the media throughout the nation. Chris's forecasts are included in the Blue Chip Financial Forecast, which is synonymous with the latest expert opinion on the future performance of the American economy. She is a former board member of the National Association of Business Economists. Since founding Chmura Economics and Analytics in 1998, Chris and her team of experts have continued to innovate data solutions such as JobsEQ, LaborEQ, Zonix, and FedSpend TOP that helps answer critical client questions across the public and private sectors. Our framing question for this session will be, what specific jobs and skills are you having a hard time filling right now? And how do you expect to change that over the next year?
Good morning, and thank you for that introduction. The title here, Using Data to Track Workforce Trends and Understand Need Across Different Occupations and Geography, I have a subtitle given the recent events that have been occurring, and that subtitle is Tracking Workforce Needs During the COVID-19 Crisis. So I've broken down this presentation into three parts. First, we'll take a look at the national outlook. How bad will this get with the COVID-19 crisis? When will the rebound start? Clearly, regional issues are going to vary based mainly on the spread of COVID-19, and here we are relying on medical folks such as yourself to help us see what that is. And then the type of industries in your region will have a big impact on how your region weathers this storm, and I'll go into some detail on how we measure that. Then we'll end with how can I track workforce needs? And here we're looking at it from a short-term perspective. So during COVID-19, it's really important that we have some data that are coming out quickly, and there we have job postings that I'll be using. And we shouldn't forget, though, the long-term occupational forecast is what we'll look at there that take into account retirement and people exiting from the industry. So beginning with the national economy, the good news, if there is any about this crisis, is that it started off of a strong economy. On the right-hand side here, you're seeing gross domestic product, the broadest indicator of economic activity. And over the last few months, it has been 2% or more. That's very good growth for the stage of this expansion. We're in the longest expansion this country has ever seen. Here's in gray is the last recession, the Great Recession because of the large declines. Here's employment on the right-hand side. I don't have the latest number in here. March numbers came out down 700. A bit surprising because the survey takes place in the middle of the month, and the crisis really didn't start until middle toward the end of the month. But in any case, here you can see going into the crisis, the economy, again, in terms of employment, was strong. Bottom line, there were no imbalances. There was nothing that suggested that we would see a recession coming anytime soon. I don't know of any economist that was expecting a recession this year, and even next year was looking pretty good in terms of economic growth. So we put out a weekly economic update, and at the end of every week we look at produce a 4-page report on the numbers that came out, the financial markets, what it's looking like, the economic numbers that came out, and a little bit of a forecast. And if any of you would be interested in receiving that, I'd be happy to put your name on our list. No charge for that. Just let Kirk know, and he can pass your name along to me. But in any case, right when we went into this downturn, Federal Reserve Chairman Powell said on a news report that there is nothing fundamentally wrong with our economy. Again, emphasizing that what we're going through right now is not your typical recession. It should be thought of more like a natural disaster or a snowstorm that's going on for a period of 2 or 3 months. Again, nothing in the economy that suggests that things are bad. Another Federal Reserve President Jerome, again, here we're back to Jerome Powell, saying here that there's every reason to believe that when the fourth quarter gets here, it's going to be a robust recovery. I was thinking I had a quote here from a different Federal Reserve President Bullard, who was looking for some significant cuts in terms of GDP and unemployment up to anywhere from 25 to 30%. But even he is saying that by the time the fourth quarter gets here, we're going to see some pretty good growth. So how will the economy be affected? We basically put together 3 scenarios. The first scenario is that COVID-19 lasts 3 months through May. And this is the scenario, I think, based on what the medical people are telling us, is the one that is going to come to pass. In this case, we see about 22 to 23 million jobs lost in the U.S., and the unemployment rate rise to 19.6% in the third quarter. And that's based on our models. In the second scenario, COVID-19 lasts 6 months through August. There we have a 28 million job loss. And then the third scenario is one where we've done some work for some states and localities. And here, some states have closed down differently or require different industries to close down. And so here we do the first scenario, that is 3 months through May, but it includes shelter in place for part of that time. And of course, in that case, we see some higher losses temporarily in terms of employment. So how does that play out in terms of GDP? Under first scenario, I'm not showing you the first quarter here because we have first quarter increasing slightly because the impact didn't start until the third month of the first quarter. By the way, those numbers will be out, I believe, April 29th. We'll get first quarter GDP. We have, again, a slightly positive number, but some economists have a negative number first quarter. Second quarter, down 14% annualized, almost 14%. Third quarter, down 5%. And fourth quarter starts to rebound and up 4% with the unemployment rate peaking at 13.3%. Some economists have a much more negative second quarter, 20% annualized decline, and then surprisingly a positive third quarter, up slightly, which, at least in our view, seems like quite a bit of a turn, especially since it's going to take time to ramp back up and for consumers to feel good about going out and being in the public again. The second scenario, where we're basically shut down for 6 months, annualized 13%. In the second quarter, again, 9%. In the third quarter, fourth quarter, again, is declining. And then first quarter, we start to turn around and the unemployment rate goes to 14%. So, as I said, employment numbers have somewhat of a lag on them. We'll really see the impact of the decline in employment when we see the April data, which will come out the first week of May. But here, initial unemployment claims are a leading indicator. You get laid off, you file for unemployment insurance, and this comes out weekly, so it's a good leading indicator. Here, I put in the last 2 recessions. Whenever we see a recession, we see initial unemployment claims go up significantly. They've gone up so much this time that you can't even really see the spikes the last 2 recessions. But in any case, this is 3 weeks of increase in initial unemployment claims. And let me take you here to the next page, which will show you those 3 weeks. So this is what they were looking like. Initial claims were fairly low for a long period of time. This increased when we start to see the impact of the coronavirus increased 4 times more than any weekly increase we had seen prior to this event taking place. Then you can see the next 2 weeks increase fairly even more so. So once we see the relief package starting to have an impact, that is firms hiring people back because they're getting the small business loans that will be forgiven if they hire their workers back. But once we see that relief package starting to work in the next 2 or 3 weeks, we should start to see these numbers come down a bit. An important point, I'm calling this a relief package. It's not a stimulus package. It's not going to stimulate the economy. It's just going to give us relief to make it through this period of time where basically the federal government and state governments have asked us to shut down so that we can get through this virus. Another leading indicator that we have is job ads. So this is something that we pulled together. We scrape or spider the different sites and look at the job ads by occupation. We'll look at a little bit of this later. And here we're looking at a few states over a 5-week time span so that you can see the decline in job ads. In Ohio, they were pretty quick and comprehensive in starting their program, the stay-at-home program, down 39%. Arizona only down 22% over that 5-week period. And here on this next slide, you're seeing all the other regions. Washington State down 35%, where there was a cluster there in Seattle, so that was early on. New York down 30%, but you can see this last period here, quite a bit of a drop-off. And then California and Texas, both job ads down 28% due to the COVID crisis. Now, the federal government has been very quick to act, and here's the bill here if you want to look at it. But some summary information. Clearly, this will help our economy weather this problem. And if you're interested, I put the pages here where you can find this. From an economic development perspective, they're providing $1.5 billion, but that's money just to prevent and respond to coronavirus. That doesn't help them, the states, go through this in terms of their revenue issues. Department of Labor, they put a lot more money into assisting dislocated workers. The payroll protection program, you're probably quite aware of, $349 billion from SBA loans. The interest rate is going to be 0.5%. It was 1% with the 2-year payment. But if the money is used for certain expenses such as payroll, then that loan is forgiven. The Federal Reserve Board announcing quite a bit in terms of lower interest rates. But last week they announced $2.3 trillion in lending, $500 billion going to state and municipalities to help them with their revenue issues. But from my understanding of what I've read so far, the smallest municipalities, rural areas, would not be able to get some of this funding. It would be just for the larger areas. And then the SBA loan takes care of businesses with less than 500 workers, and the Fed will be giving loans to companies with 10,000 or fewer workers, and those would be 4-year loans. Now here, GDP, and here we put in our forecast to give you a sense of what this would look like. So here you see the decline in the second and third quarter, and this looks really bad. Here's the Great Recession that we had. These numbers are annualized, meaning that, and that's the way that we always look at GDP. So this 14% decline or so that we're looking at, if it were a 1 quarter decline, actually it would only be down about 5%, as opposed to this 14% that we're looking at here. Here you see the second quarter, and then we expect to see growth following that. Now, you probably heard a lot of different assumptions in terms of what the forecasts are from different economists, and so we all have our 100, 200, 1,000 equation macro models, but our assumptions are different. And so some assumptions, we're all relying on the medical community to give us an idea of how long this will last, but there are other assumptions in there, such as the ripple effect, how many manufacturing plants will close. The automobile industry is very slow and has shut down or slowed much of its operations. Goodyear announced recently that it would close all of its plants, and that's because it had reduced sales for tires and that type of thing. So in any case, the one thing that all economists seem to agree on is that this is going to be sharp, it's going to be short, but it's not going to be sustained. And so I've gotten calls from some reporters who have said when they hear the numbers, is this going to be a depression? And my answer is no, it's not a depression. Let's take a look at what the depression did look like. So on the right-hand side, GDP from 1929 to 1933 fell 27%. On the left-hand side, the unemployment rate went up to 25% at one point, and over a decade stayed 10% or higher. So clearly, again, this is not a depression. The depression was sustained. This is it's going to be called, who knows what they're going to come up with in terms of the term, the Great Recession or the Great COVID-19 recession, but it's not going to be sustained. It's going to be sharp, and it's going to be short, and there's going to be great variation by region. And this is a chart that I'm sure you all are used to looking at probably on a daily basis to see where the virus outbreak is greatest. I like to look at this University of Washington site, which again, you probably all have been looking at. I like this one in particular. Here's for the US because you can click on it and show it for a particular region. In fact, Esri, along with Johns Hopkins, has just released, I believe yesterday, a state county chart. So you can go in and look at the counties where there are clusters, and there's some surprising clusters that weren't evident before when they were just doing the circles, such as in southern Georgia. But in any case, again, that's Esri and Johns Hopkins working together with a county map. But I like this one because you can see the confidence interval and quite a large confidence interval. And again, by state, it differs greatly. And then in light of all this, we have taken a look at, well, how vulnerable are various regions to the COVID-19 outbreak in terms of their economic resiliency. And so what we did here is we went down to a 3-digit NAICS code level. What that means is these numbers here that you're seeing are 2-digit NAICS. So in the retail sector, a 3-digit NAICS code would be department store or drugstores, grocery stores, and all of those are affected much differently. So at the 3-digit level, we went in, looked at job postings, looked at initial claims, looked at what some of the experts were saying in terms of the Hotel Association of America, the Restaurant Association, and then we came up with expected employment declines for all of these different sectors, actually at the 3-digit sector. And then that's how we came up with how vulnerable is my region, with those in red being more vulnerable, those in white less, or yellow less vulnerable, and the US is a base at 100. So if your region is 150, then you would expect to see job losses 50% worse than the nation overall, And if your region is a 90, then the job loss would be 10% less. Now, so at the top, no surprise, it's rank ordered most affected: arts and entertainment, accommodation and food services. And then toward the bottom, some less affected: management of companies. So this is headquarters, professional, scientific. Many of these people can be working from home. And so the job loss is not as great. One, for those of you who have military in your region, we did not have military on here. And we just reran the numbers last week and should be getting at something today or tomorrow with military included. So if there's a military base, such as in this area here, those reds will be not quite as red. And again, if you want to check out our blog, that should be out today or tomorrow. So in terms of tracking workforce needs during the COVID-19 crisis, again, I'm going to look at this from the short-term perspective, mostly with job postings, and from a long-term perspective. So what I'm relying on here is our software JobsEQ that contains forecasts in it, as well as has job postings, so short-term data. So here you're looking for the entire U.S. Job postings or job ads. Again, a leading indicator of the labor market. And you can see that when this crisis started, 18% decline, 14% decline, and most recently just a 1% decline. And with the latest numbers, we have broad-based decline in just about all occupations. There are some that are increasing, such as janitors, because of stores closing down earlier and because we have to do all of this cleaning up to make sure that areas are clean for customers coming in, or even, I'm sure, at hospitals and other places that's even more intensive. So we see an increase in job ads for janitors, as well as stock clerks, because people are purchasing a lot at some of the stores, and we're having to see the inventory stocked every evening. So again, looking at job ads, the 2 weeks starting in March 1st and the 2 weeks starting in March 22nd versus March 22nd, you can see that yes, registered nurses are up there, nursing, LPNs, personal care aides, and home health aides. Also, drivers and sales workers are seeing quite a big jump in terms of job ads and the need for those particular occupations. Which occupations are most at risk? And for this, we went to Washington State to show you the second week of March 2020 compared with that week in March the previous year. Again, we chose Washington because of the cluster that occurred there in Seattle. And you can see clearly here some of the declines in terms of first-line supervisors at the bottom, food preparers, restaurants, retail, and hotels clearly have been impacted significantly during this crisis. And then here we're just taking a closer look at the food service occupations, same time period, and again in Washington. And here you see coffee shops, a huge decline. We see bartenders, a huge decline in the occupations, in the ads for those type of occupations. I noticed that some of you who have registered for this event were educators. So I thought that you would be interested in knowing what kind of occupations and what skills are being required to see if it syncs up with what you're teaching at this point in time. And so I just went to the Richmond MSA, and I looked at the occupations or the firms that were hiring, and you could see them listed here. Then I looked more specifically at VCU Health and HCA, two medical institutions. And what I did was to then stay in the Richmond MSA, but then to put here just tell me the occupations that VCU and HCA are advertising for right now. And you can see those occupations here: registered nurse, radiological technicians, and on down the line. So again, the question is, if I'm in the Richmond area or providing education services for healthcare, am I providing for these occupations? And more specifically, are we offering the certifications that are needed? Again, sticking with VCU and the HCA, in terms of their job ads, they have basic life support, the things that you would expect to see, pediatric advanced life support. And basically, when we scrape these job ads, we save the entire job ad, and then we can later query for particular information, such as the wages. And it's interesting that looking at nurses that have some of these certifications relative to those that don't, those with the certifications typically have a higher wage. And then one more look here in terms of the job ads. We can look at the hard skills and the soft skills. So here on the top, hard skills, again, no surprise: anatomy, physiology, patient care. And then in terms of the soft skills, things that are important: communication and team player. And then finally, so what academic programs are required? And in this case, what I did is put in VCU Health and HCA, again, looking at, well, what degrees do they need? And here you can see some of those that you would expect: nursing, biology toward the bottom, healthcare. But it was surprising to me that 5 out of the top 10 were business, healthcare administration, business, accounting, and finance, seeing how important that is to these two healthcare institutions. And then one more item here on the job postings is sometimes when we have people using these postings, they set up alerts. So they'd like to know, for example, anytime a job was new, they get an alert daily or weekly or monthly, or closed. So we may see that 20 closed jobs in healthcare, and the reason for that is because they presumably filled that job, or they may be interested in a particular occupation. They want to know when that occupation comes up, or new jobs in a particular zip code. So that's the short term, and of course that would be really important over this period with the COVID-19 crisis going on. But the long term, we will be back to a growing economy, and we will be back to a tight labor market. And so this is information that we have down to the zip code level, actually to the census block level, so that if you had a particular footprint, you could create that footprint and look at it. Here I'm looking at the Cleveland, Akron, Canton combined service area. And here you're seeing at the top, rank ordered, the largest employer there is healthcare. That's not always the case by region. But next you see is manufacturing. So we have average wages here, and then a spark chart showing you what it looked like over the past 5 years. Then all the way to the right, a forecast. And this is an annual forecast, but it's the average of a 7-year forecast. So what you typically see when you go to the BLS or your state websites is the change in terms of growth. So here, healthcare up 1.3%, and I'm sorry, healthcare up 0.6%, and that's equivalent to 1,800 jobs. But it's important to look beyond that. That 1,800 jobs is what you're seeing because the industry is growing and you need more workers. But importantly, under exits, you're seeing 14,000 people exit healthcare because they're retiring. And you're seeing another 14,000 transferring to different industries. So altogether, you have an annual need in this Cleveland metro area of 30,000 people in terms of the healthcare industry. And just to emphasize again, to show how important it is to look beyond just the change. Here, if we look at manufacturing, down 1.3%, that's a loss of 3,000 jobs. So people considering whether to go into manufacturing see that, they say, well, why would I do that in a declining industry? But in reality, because of exits, there's actually 9,000 people who are retiring a year. And so those jobs need to be filled. And coming all the way over here to the wage, you can see that it pays a very good wage. In fact, better than the average, in fact, better than healthcare. And by the way, healthcare, the social assistance side is pulling that healthcare wage down. So this is one way that by region, by zip code, by footprint, you can take a look at what is the demand by industry. And of course, it's occupations that we're really more interested in. And so we can look at that same information by occupation. And here within Cleveland, I'm just looking at the healthcare industry. And you can see, again, the same type of information, the registered nurses, their employment, the annual wages, how many people are exiting because they're retiring. So this is a 1 year average over 7 years, the need, and then the total demand all the way to the right-hand side. And again, looking at the different type of occupations here, it was interesting to me that when we got down to number 13, we're looking at maids and housekeeping cleaners. And the reason why I'm pointing out this one is because so many other industries we're seeing declines, that is people getting laid off. And here's an example. If I look at the hotel industry and I look at within the Cleveland area, if I assume that 60% of all the hotel workers are going to lose their jobs, that's 7,400 workers, and I put it into this what if report that we have, then it indicates that there are going to be janitors and cleaners, about 142 of them losing their jobs. And so that's one skill set that right now is very much in demand. And so for those of you who are at hospitals needing those workers, of course, you've got different rules that you have to pass a drug test and that type of thing, but you should be able to find those workers at this point. One other thing that we've been working with, kind of a new thing to us, and that is resumes. So as similar to crawling the websites and finding all the job ads out there, we can now go out and find resumes, which can really be interesting, especially once the market tightens up again. It'll be important to know where these students who are graduating are actually going to. So we can put in a particular school or an occupation and find out that many of them are moving to San Francisco or other areas. And in this case, I took, since we were with Cleveland right now, I kept with Cleveland, and I said, let me see Case Western Reserve, and specifically the occupations of nursing, biomedical engineering, and medical. And when I did that, here it showed me where those individuals are now working. Most of them working at Case Western Reserve. And number 2 is the Cleveland Clinic Foundation. And you can see going on down where those students are working now. And then finally, this is something that we're seeing a lot more, and that is businesses, and especially those of you that are associations, are getting your businesses to talk to the educators to make sure that they are producing the students with the skills that are needed. And so here I went into our job postings, and in the Cleveland area, again, I said, show me all the job postings that require a bachelor's degree. And you can see, again, the importance of medical showing up with registered nurses there, medical and health service managers, closer to the bottom, social and human services, and then software developers, the importance of IT and computer use. On this next slide, I just pulled out nurse anesthetist. And in the Cleveland area, there's right now openings for 32 of this particular skill. And here you can see the locations where those job ads are. And then I wanted to figure out, well, are we graduating enough nurses and anesthetists? Again, from the perspective of making sure that businesses are talking to the educators and training providers to let them know what skills are in demand. So within our software as well, we can look at awards. So this is a year lag, but within the Cleveland Akron combined statistical area, there's only one higher ed institution that's giving out awards or providing programs for the nurse anesthetist, and that is Case Western Reserve. And you could see that they graduated 29 last year, and there's a demand right now for 32, suggesting that perhaps there's more room for other institutions to offer this program, or for Case Western Reserve to encourage more people into this program. So, in conclusion then, this crisis will end, and optimism and leadership can go a long way at this time, and all of you I know are in positions of leadership that could be promoting and helping people see this will end, and the economy will get back to normal. It's going to be sharp, it's going to be short, but it won't be sustained as we're seeing it now. The regional issues will vary greatly depending on how much COVID-19 spreads and the type of industries that you have in your region. Think about the short term with using job postings perhaps to identify what's happening in your region, but over the long run, clearly there are forecasts out there to help you see what the demand is going to be, including that of retirement. I'm sure many of you within your own institution have looked at retirement, but getting a sense of it in a region would be helpful as well. And with that, I think we have a little time left if there are any questions.
Hey, Chris, we have a question from Beth Shepard about what website your data summaries are coming from. I was hoping you could contextualize a little bit more about your JobsEQ platform.
Okay, so we have a platform called JobsEQ that's EQ, short for equilibrium. So it's used by over 500 entities across the U.S., and it provides a lot of labor data, demographic data, but it for any particular region, it'll go down to the occupation and look at the forecast over a 7-10 year period for a particular occupation and for skills. And so educators will use it to try to figure out what curriculum to teach. Some states require, and institutions that, which makes sense, that you show there is demand before you add the curriculum. So cyber, for example, it's being offered by more schools these days, and they have to show that it is in demand. So we can look at the job postings for cyber to see how many people are asking for it, as well as what occupations use cyber and in terms of growth. Site selectors use JobsEQ to try to figure out, if I move to a certain region, am I going to find the workers that I need? Economic developers use it to show prospects that they do have the workers in a region, or to do a labor market study, or to do a cluster analysis of what industries are growing, how can I lift wages in my region. And then workforce developers use it, especially workforce, as in the Workforce Investment Act, when they have displaced workers, to help them identify alternative occupations that they can be trained in to get jobs quickly.
Thank you very much. We also had a question. Does the data, when comparing something like manufacturing or healthcare retirement and transfer versus jobs added and jobs lost, does that account for potential changes given automation of tasks in industries?
Yes, so underlying all this is the national trends. And so it does take into account offshoring or increased productivity. For your industry, it was interesting several years ago when there was a move toward less LPNs and more RNs, and that differed by healthcare type of industry, of course, that we saw that shift. And we also see shifts because of administrations. It was pretty amazing to see the demand during the Obama administration for green type occupations, such as windmills, and people that fix windmills. And when we had the new forecast with the Trump administration, those very positive growth numbers went to flat. So all those things are taken into account in the forecast.
We also had a question. Are there any projections available for the period post-COVID?
That's a good question. So that's something last week we've started to think about, and we're starting to work through in our minds how we're going to show that. And we've been working with Esri, the web geolocation sort of tool, mapping tool that many people use to help think through that down to a census tract level. So at this point, no, we don't have that yet, but we're working through some models to be able to present that in maybe another week or two. So take a look at our site, our blog every once in a while, and we'll get that out. We could get it to Kurt too, and then he could distribute that to you guys once that becomes available.
Awesome. Thank you so much, Chris. We have a few more questions coming in. Just a second.
Good.
Chris,
go
sorry,
ahead.
go ahead.
No, go ahead.
Chris Robinson asks, how does this modeling account for overlap in healthcare provider skills and encroachment? For example, having a nurse stretch a patient instead of a physical therapist.
Okay, you cracked up on the last piece of that. Something about a nurse and a physical therapist?
For example, having a nurse stretch a patient instead of a physical therapist. For example, like a nurse doing something that would normally fall under the scope of practice of a physical therapist.
Right. We don't get down to that level of detail, but I'm sure during this COVID-19 crisis, there's some great cross-training and cross-skill usage going on. I saw that nurse practitioners I don't know if it was an association, or if it just was a regional push, trying to get some more autonomy to be able to help out during this time without having to go back through doctors. And it seemed like that was a short-term COVID-19 request as opposed to something long-term. But just another example of, yes, we're not going down to that level of detail, but I'm sure that's something that's happening.
And one more question. Valerie DeFore of Health Force Minnesota asks, she says first, we think some changes due to COVID will stick, at least in higher education. Is there any good way to integrate workforce changes into future prediction models?
Yeah, that's something that we're all thinking about. I think as we work through our next forecast, that we're going to see some slight changes due to that, but I don't think they're going to happen as quickly as some other people do. And just taking office space as an example, so we're all working from home, or many of us are working from home, and so we're realizing we don't have to have an office. Maybe I don't need 10,000 square feet, maybe just 5,000. Well, the problem is that most landlords don't like giving out leases that are 1 or 2 or 3 years in length. They'd rather have 5 or 10. So as I'm thinking, well, I don't need all this space. I'm going to have to wait until my 5-year lease or my 7-year lease ends. Maybe I'm toward the end of it, so I can change that. And so we'll see less people, less need for real estate, commercial real estate. Similarly with, our phones, and now being able to see the doctor through our phone. There's some technology I think that doctors' offices are going to have to get up to speed on in order to use that more. So I think we will see some shift, but I think that's going to be a little slower in coming than some people are forecasting. But yes, as that does start to happen, we will reflect that in our forecast for occupations and skills.
Thank you so much, Chris. We also have a number of compliments, by the way, about how informative and succinct your presentation has been. So thank you very much for joining us today and joining us this morning.
Okay, you're welcome. Enjoy the rest of your conference.